The ICU in the hospital is really an area where any person can end up being a patient.
My name is Angie Schreckengost, and I live out in Kingston, Washington. The evening of February 7th, my husband and I finished an ordinary day. We had company for dinner, and they left, and my husband and I sort of settled into the evening chores. He actually went out and took the garbage cans down to the road. But he came in and he said, "Angie, darling." And I looked up and he looked at me and he says, "I think I'm having a heart attack."
When a patient first arrives in ICU, we usually need about 15 or 20 minutes with that patient to get them stable and to really assess what's going on. So that's often a time when families are asked to go out and wait in the waiting area. And I'm sure to them it feels a lot longer than the 15 or 20 minutes.
Patients come at their most vulnerable points in their life because for them it truly is a matter of life and death. And for their families, it's an emotional roller coaster.
They set him up in ICU and the vigil began. And I was there for 30 days. And a lot of those nights, especially in the beginning, I didn't leave because I didn't know whether he'd be there when I came back.
Our families are reluctant to leave the ICU and they want to stay close and they want to be in our waiting area because they want to be close to their loved one. In the ICU, things can change in a moment, and a lot of these families have seen that.
So right now in the ICU, we have a couple challenges in terms of providing great care to our patients' families. The first one is that we're small. Some of our patient rooms are large, but most of them would be smaller. And because of all the high-tech monitoring equipment that we have, a lot of times there's not enough room to bring in a bunch of chairs for family to sit in. A lot of times people will want to have a meal while they're in the room, and we just don't have the tables or the setup that would leave enough room for the nurses and the physicians to do their jobs.
I know a couple times during this stretch, the room got so overcrowded with other people and other situations going on, people would overflow out into the hallway. After I sat there for days, my legs, I have some leg problems, and they started swelling. And so one of the gals I met in there, she says, "You need to get your feet up." Well, there's no place to put your feet up. You're sitting shoulder to shoulder with people if the place is full. One of the nurses came, she mentioned it to one of the nurses, and one of the nurses came dragging in a little metal stool and had me put my feet up on it. And I got to keep that stool, I think, for a day and into the next morning, and then they had to have it back because they needed it back in the ICU.
You know, we're dealing most of the time with the most vulnerable people in our community. And most of the time, their loved ones are quite vulnerable themselves and have physical problems where it would be nice for them to be able to put their feet up if they're sitting, to have a recliner available for them to just kind of relax. And unfortunately, we don't have that. We've got some wooden chairs that are great for a short period of time, but for some people who'd like to stay longer, we're sort of limited.
When we need a sleeper chair for someone's loved one to spend the night, we have to call all the other floors and see who has a sleeper chair. And sometimes if, 2 West or 2 Southeast or one of the other floors is busy and they have families sleeping in their sleeper chairs, then we don't have a sleeper chair for the families. And, it's this roundabout process. There's no, we don't have our own. And why we don't have our own is because it's more important to have, another kidney dialysis machine than it is to have a sleeper chair. And so when we have to make those kind of choices based on equipment from our major budgets, then we have to make the choices that's going to save the patient's life as opposed to what's going to make a family comfortable.
I know that everybody doesn't spend as much time in the ICU as I do, but I do know that there isn't a person in there that isn't experiencing worry and trauma, and their life has changed in a blink.
In the ICU, we do everything we can to help keep the patients comfortable. And sometimes it really is hard to facilitate keeping the family members comfortable. Sometimes I wish that we could do something more for them, because it's important that we're able to care for the whole family, not just for the patient in the bed.